Obviously, our jobs are highly relational, and so we do respond to things that have an impact on people's mental health every day. And the situation that people are in and living in limbo is a situation that can cause trauma and does cause trauma for people. You know, settling in another country is complex. It's a process and it can be a long journey for anyone. And I think with all the extra barriers, challenges people experience, like English as a second language, finding employment, housing, learning new systems, I think that can have a significant impact.
One way to help them is visit them in their homes, and especially when they hear of funerals, if somebody dies in Africa or here, if a pastor appears in the house, and they will be a bit relieved. More accurately, you need things like spiritual retreats, like seminars and conferences, in order to help them bridge the gap between, because they are coming from extreme situation to another extreme reality. So in this way, it causes a cultural shock. And if there is a cultural shock, the individual will not be able to produce well.
People who are seeking asylum, their status hasn't been resolved. So someone who comes as a refugee, their status, they are a refugee. They've gone through that process. They've been deemed to be a refugee. Someone who is seeking asylum is still going through that process. So they are living in limbo and they haven't found that place of safety yet. That has a significant impact on people's mental health.
Not all Australians really know the gravity of the situations the refugees face back in Africa. What I could suggest to them is try to know their situations and to be in their shoes. That will make everything just very simple.
Working with people in this industry is such a privilege. So I could give you lots of success stories about people coming here and doing amazing things, but I think the success stories are when people feel like they belong. I think success is about belonging and feeling accepted.
Yes, majority are refugees, yes, who have come from traumatic situations. And even if they have come from traumatic experience and they are living here in Australia, still they belong to extended families. And some of these families are still back in South Sudan and in the refugee camps in Uganda. And always they hear of news, of sad news really. This affects them day by day. And they need somebody always to be there for them, to guide them, and to actually to take care of them is very important because it can reduce a lot of stress, and they can feel happy, and when they are happy, then they will be able to be well balanced.
I think tending to people's spiritual health is part of identity and who they are, and it's so linked in with who people are. So I think without that we wouldn't be providing a good service.
I go just drive and go to talk to people, visit families. As I keep on talking, then at least the level of stress is going down. Also, one of the ways is to provide at least adequate education to people who came to Australia as adults, if that need be, and also those who are not, the children who are not able to cope up well, they can be given extra lessons, and also to train maybe some of them in job, provide job skills for them. If they are provided with the skills, like in a vocational training center, then they can be able to be comfortable and to have confidence in themselves so that they can be able to feel at home.